This can be a very common question asked in medical school interviews. Remember, the person interviewing you may have asked this question to many other candidates that day, so it's important to try and give an answer that's personable to you and will make you stand out. You can draw on inspiration from your work experience. Have you observed something that inspired you to pursue a career in medicine? Try and think of the role of a doctor specifically and what attributes that you have that will make you suitable to that profession. Being compassionate and caring is important, but remember there's other careers that would allow you to do this in a better capacity, for example, nursing. So if this is your main reason, you may be questioned further by the interviewer. Medicine is an evolving career, and keeping up to date with advancements can be intellectually stimulating. It's a varied career. There's usually a niche for everybody. Different specialties can be very different in their day-to-day activities. This can be very appealing to people because there's a wide scope of what you can do and where you can do it. Medicine is also a profession that will allow you to work in a wide range of places across the world, and it'll open many doors for you. Maybe you've got a particular interest in a specialty. As medicine has a wide spectrum of opportunity, it can sometimes sound a little bit naive to be fixed on a particular specialty. Although some people have a strong passion towards certain fields from the very beginning. If you have a particular interest, make sure that you've really thought about it and you've thought about the day-to-day role of that specialty and why you think that you'll be suitable. Being part of a team is an important aspect of being a doctor, as there are many other healthcare careers that will allow you to be part of a team. So make sure you think of the doctor's role within teams and try and relate this back to anything that you've observed during your work experience. It will often be frowned upon by most interviewers if your main ambition in pursuing a career in medicine is rooted in financial gain. There are other career paths that would make this pursuit easier, and there are many other aspects of medicine that would make it difficult to continue if your only incentive was money orientated. Pressure from family members is also frowned upon because medicine's a lifelong commitment and candidates should have the desire for the career rather than expectation from other people. Likewise, if you've got many doctors in the family, you can draw on this in some ways because you'll have seen firsthand the positives and the negatives of the career from the perspective of a family member, but interviewers may be curious how influenced or pressured you've been from your family members to follow in the career path. Finally, hunger for prestige. Of course, there's a lot of responsibility that comes with being a doctor, but you should have other deeper reasons for applying to medicine than simply an elevated social status. Think of examples from your work experience, and this doesn't have to be medicine related. Think of qualities that you need to become a doctor and what you've seen. Reflect on these and think of your own attributes and how this applies to the profession.